To tell you, I'm just trying to teach you the concepts of all these different theories and techniques. Reality therapy is a good one. It's used a lot, and we're going to find out just how frequently it's used. It's not for anything serious. It's not going to cure any psychosis, but it's a really good um, counseling technique. Not a bad idea. It's kind of like RABT. It's kind of like CBT, but the emphasis is a lot different. So let's go ahead and get started. Chapter 11, Reality Therapy. The guy we're talking about is William Glasser, and there's Glasser. He's from northeastern Ohio. Northeastern Ohio is around Cleveland and Akron. He's from a small town. He's not from either of those places, but he's from northeastern Ohio. He studied chemical engineering, clinical psychology, and psychiatry, but he didn't really like psychiatry because he didn't agree with Freud. He rejected the Freudian model and began developing his own type of therapy, which eventually became known as reality therapy. And it makes a lot of sense when you get into it. Reality therapists believe that underlying problems of all clients is the same. They're either involved in present unsatisfying relationships or they lack what even could be called a relationship. So they're either not in a relationship or in a bad relationship. If the therapy is to be successful, the therapist must guide the client to a satisfying relationship and literally teach the client to behave in more effective ways than he or she is presently behaving. Few clients have any clear understanding that their problem is the way that they are choosing to behave. What they do know is that they feel a great deal of pain or that they are unhappy because they have been sent for counseling by someone with authority who is not satisfied with their behavior. It's either a court official, a school administrator, a spouse, or a parent. Something is wrong, and they need to change the behavior. Since clients choose behaviors as a way to deal with the frustration caused by unsatisfying relationships, they can range from mild depression to profound psychosis. Glasser actually believes that clients should not be saddled with a label unless it is necessary for insurance purposes. And the answer to that is it's always necessary for insurance purposes. Since behaviors are coping techniques, Glasser feels that they are not mental illnesses. They're poor coping techniques. It isn't known why people choose the mental illness that they do, but we do. We choose our own mental illnesses. However, knowing why people choose the problems they do is not necessary for successful therapy. Therapy consists mainly of teaching clients to make more effective choices as they deal with the people that they need in their lives. This is done through choice therapy. If this is successful, clients will begin to choose more effective behaviors. According to the reality theorists, we are born with 5 genetically encoded needs: to survive, to love and belong, for power, freedom, and fun. Each of us all have 5 needs, but each may have different strengths and select ones of us. Some of us have stronger need to survive. Some need love more. Some need power. Some need freedom, and some need fun. Our brain functions as a control system. It continually monitors our feelings to determine how well we are doing in our lifelong effort to satisfy these needs. Whenever we feel bad, one or more of these 5 needs is unsatisfied. Driven by pain, we try to figure out how to feel better. Reality therapists teach clients choice theory so clients can identify frustrated needs and try to satisfy it. If clients succeed, they're rewarded with good feelings. Choice theory explains that we do not satisfy our needs directly. What we do, beginning shortly after birth and continuing all of our lives, is to keep close track of anything we do that feels very good. We store this knowledge in a special place in our brain called our quality world. The quality world isn't large, but it contains all the people we are the closest to and most enjoy being with. It also contains people we don't know, but whom we imagine it would be pleasurable to know. It also contains things we would like to own. It contains things we can't own, but which give us pleasure. Okay. So who are we talking about? And what are we talking about? We're talking about owning things. We're talking about people's wishes. Gee, I wish I had a sports car. Gee, I wish I had a yacht. Gee, I wish I had whatever. My quality world isn't very large, and my quality world doesn't include a lot of things. I already have a sports car, and I have a chainsaw. What else do I need? I've been married for 40, let me think, 79, 46, it'll be 46 years in June. So there you go. What kind of power do I need? I'm a college professor. What kind of power do you need if you're a college professor? Oh, anyway, so my quality world, not very large. I live on a really nice property in the middle of a cornfield, and I own an orchard. So what more could I ask for? I have a cherry tree that produces what? 6 gallons last year. I pressed 18 gallons of apple cider. Wow. Okay, I'm in good shape. I have a pickup truck. Our quality world is the world that we would live in if we could. It is the core of our lives. And one of the, and this I need to explain to you. One of the reasons I will be leaving in the fall is because I am not coming back to Salie. The reason I'm not coming back to Salie is because it's in the mountains. I'm a flatlander, and the land that you see behind these ladies, that's the kind of land that I was born in. That's the kind of land that I appreciate. Okay, I'm a flatlander. Um, living in the mountains doesn't appeal to me, and that's one of the reasons I'm not coming back. Because I can't live in the mountains. I can't live in the desert. I grew up in farming country. Actually, I grew up in farming country that was primarily a swamp before they made it into fields. But so I'm used to wet. I'm used to wet. I'm used to green, and I'm used to flat. So that that ain't Salie or Chinley, that's for sure. Anyway, I love you guys, but I'm just from a different place. I'm just from a different place in time. That sounds like a song, doesn't it? Anyway, so my quality world is green and flat, and so living in the middle of a cornfield is pretty nice for me. Is just about ideal. That's my quality world. Our quality world is the world that we would live in if we could, and I'm living where I should be, I guess. It is the core of our lives. It is based on our needs, except that it is quite specific, and our needs are quite general. People are by far the most important component of this world, and these are the people that we most want to connect with. People who enter therapy typically have no one in their quality world or someone they are unable to relate to in a satisfying way. For therapy to have a chance of success, therapists must be people clients would consider putting in their quality world. Not easy. Not easy. Getting into the client's quality world is the art of therapy. It is from this relationship with the therapist that clients begin to learn how to get closer to the people that they need. Choice theory asserts that all we ever do from the birth to death is behave, and that our behavior is internally motivated and chosen. Every total behavior is always our best attempt to get what we want to satisfy our needs. Behavior is purposeful because it is designed to close the gap between what we want and what we perceive we are getting. Specific behaviors are always generated from this discrepancy. Our behaviors come from inside, and thus we choose our destiny. Total behavior teaches that all behavior is made up of four inseparable but distinct components: acting, thinking, feeling, and physiology. These four things must accompany all of our actions, our thoughts, and our feelings. We can't directly choose our feelings and physiology, but we can indirectly choose many feelings and some of our physiology. Glasser says that to speak of being depressed, having a headache, or being angry implies passivity and lacks personal responsibility. Glasser wants references that are more active. I'm depressing, I'm headaching, I'm angering. Glasser offers three explanations as to why we choose to suffer. Whenever anyone is involved in a frustrating relationship, it is normal to choose anger. From this angering, it is easy to lash out and hurt someone. Depressing and many other chosen symptoms immobilize us and provide a way to restrain this anger. Depressing is the most common way people have discovered to ask for help without begging. When we suffer, people reach out to us. It is important for our need for power that we not beg. And depressing is the perfect way to get attention and even help without begging. Glasser's last explanation of why we choose to suffer: depressing and all other forms of what we are commonly called mental illnesses allows us to avoid doing what we are afraid to do. Larry lost his job and immediately got depressed. Larry's friends told him, "Look, Larry, don't wait around. Get out your resume. The longer you wait, the harder it is to get work." Larry replied, "You're right, but I'm just too depressed to do it. Maybe next week." Larry is doing this because he is afraid there may be no good jobs. Larry doesn't want any more rejection. The choice to depress gets Larry off the hook. And then he doesn't have to worry about rejection. Reality therapy focuses quickly on the unsatisfying relationship of the lack of a relationship, which is the cause of the problem. It doesn't take much time or much skill to find out which it is, as the client will almost always bring it up. But the client will blame the other party for the failure of the relationship or for the misery he or she is suffering. Reality therapy does not get involved with finding fault. It focuses on what the client can control in the relationship. Glasser teaches that there is no sense talking about what the client can't control. When clients point out correctly that this is unfair, the therapist may agree and say, there is no guarantee that life is fair. The only guarantee is that you are the only person whom you know you can change. Complaining may feel good for a short time, but it is completely ineffective behavior. If complaining were effective, there would be a lot more happy people in the world. Harsh truth: complaining doesn't help. There is no shortage of people who spend their lives complaining and getting nowhere, but reality therapists do not listen very long to complaining, blaming, and criticizing. These are the three most ineffective behaviors in our behavioral repertoire. Clients tend to be expert complainers, blamers, and criticizers. Because reality therapists give short attention to these three self-defeating behaviors, they tend to disappear from therapy. If we choose all that we do, we must be responsible for what we choose. This means that the therapist should never, this kind of sounds like existentialism, doesn't it? Yeah, it's getting close. This means that the therapist should never lose sight of the fact that clients are responsible for what they do. Clients may reject the idea that they are choosing to be sick or to behave in a crazy way. Therapists are wise not to engage in a debate with these clients. Doing so gives the clients an excuse to choose to behave in even more self-defeating ways in an attempt to convince the therapist that they can't do much for themselves. Really? Therapists should focus on what clients can choose, for doing so gets them closer to the people that they need. Being involved in meaningful activities such as work is a good way to gain the respect of other people. It is very difficult for adults to feel good about themselves if they don't engage in some form of meaningful activity. All programs for the mentally ill should include some work or meaningful activity. As clients begin to feel good about themselves, it is less necessary for them to continue to choose irresponsible behaviors. Where's it going to go? Oh, it's going to go right there, I guess. Glasser feels that therapists should be no one other than themselves. Transference is a way that both therapist and client avoid taking responsibility for whom they are now. Most clients are all too willing to avoid taking responsibility for what they are doing and tend to leap at anything the therapist offers that will help them avoid behaving responsibly. Glasser feels that transference is a way to keep from getting involved in clients' lives. The reality therapist welcomes responsible involvement. It is the best and the quickest way to teach clients how to relate to the people that they need. By being themselves, therapists can use the relationship to teach clients how to relate to others in their lives. Most clients come to counseling convinced that their problems started in the past and that they must revisit the past if they are to be helped. Glasser grants that we are products of the past, but argues that we are not able to change our past. Dealing with the past is an attractive alternative to avoid dealing with their real problems, which are always associated with an unsatisfying present relationship. Although we may have been traumatized in the past, Glasser believes we are not victims of the past unless we presently choose to be. All we can do is try to change our current behavior so that we can get along with people we need now. In traditional therapy, a great deal of time is spent focusing on symptoms by asking clients how they feel and why they are obsessing or phobicking. The pain of the symptom that clients choose is not important to the counseling process. Reality therapists spend little time on symptoms because they cannot be improved until clients' significant relationships are improved. Glasser contends that clients will complain about their symptoms and take long journeys into their past if the therapist allows them to. Focusing on problems of the present can shorten most therapy considerably. The goals of the therapy are to help clients get connected or reconnected with the people that they have chosen to put in their quality world. Teach clients choice theory. Connect with the people who are addicted to self-pleasure and have no people in their quality world. This last group may participate in violent behavior, addictions, or other kinds of antisocial addictions. Such people scoff at the idea that they need other people. As soon as a counselor recognizes that they are dealing with a disconnected, pleasure-seeking person, their only goal should be making contact with this person. Look at that. Well, wait a minute here. Fix this. There we go. There it is. Okay. What have I done? Okay. The primary function of reality therapists is to assist clients in dealing with the present. From the beginning, the practice of reality therapy takes place in the present. From the satisfying client-therapist relationship, the therapists are able to engage clients in an evaluation of all their relationships, exploring what they want and how effective they are at getting what they want. From this, clients can decide what they can do to improve the relationships they have or how to find new ones. And I've got this lady swiping to the left. She's swiping. Yeah, okay, I don't remember whether swiping to the right is accepting or swiping to the right. Sorry, I've never been on one of those sites. I'm no fun. Just ask my wife. Clients will learn that therapy is more than just talk as they are exposed to the behaviors that have worked in lives of their therapists. Clients will more than likely find therapy to be gently but firmly confronting. Clients are constantly being asked if what they are choosing to do is bringing them closer to the people they need or getting them in touch with new people if they have no one now. For involvement between the therapist and the client to occur, the counselor must have certain personal qualities, including warmth, understanding, acceptance, concern, respect for the client, openness, and the willingness to be challenged by others. The best way to achieve this is by being willing to listen to the client. The art of reality therapy is to be able to establish a therapeutic relationship with almost every client the therapist is asked to help. Practice of this type of therapy consists of two major components: creating counseling environments and implementing specific procedures that lead to changes in behavior. In creating the counseling environment should be a living example of choice theory in action. Counselors use no external control behaviors. In this coercion-free atmosphere, clients feel free to be creative and to begin to try new behaviors or past successful behaviors they haven't used in a long, long time. And they're creating their own environment. That's why I put that in there. He's just bicycling along, creating his own environment. Change is always a choice. Reality therapists always ask clients what they want from therapy. They also inquire about the choices clients are making in their relationships. Glasser maintains that there is always a major unsatisfied relationship that causes the need for counseling. In the first session, the therapist looks for and defines the wants of the client. The therapist also looks for a key unsatisfying present relationship, usually a spouse, a child, a parent, or an employer. There is a tendency for clients to blame the other person in the relationship. When clients begin to realize that they can control only their own behavior, therapy is underway. The rest of the therapy focuses on how clients can make better choices. Their choices are available, more choices are available than clients realize, and the therapist explores these possible choices. Bobby came to see a reality therapist because of depression. The therapist convinced her that her problem wasn't depression, but her relationship with Bob. The therapist talked to Bobby about her relationship with Bob, and Bobby admitted that Bob was such a loser. He never did anything but go to work and drink beer. No wonder she was depressed. The therapist convinced her that blaming Bob was the wrong choice. She needed to do something to change her life. Bobby stopped focusing on Bob and began working toward a degree in accounting. Bob became jealous of Bobby's efforts and went back to school himself. Glasser and his associates used the acronym WDEP to describe key procedures that can be used in the practice of reality therapy. W stands for wants and needs, D stands for direction and doing, E stands for evaluation, and P stands for planning and commitment. Through the therapist's skillful questioning, clients are encouraged to recognize, define, and refine how they wish to meet their needs. This involves exploring the client's quality world and moving their perceptions of the external world closer to their internal world of wants. Skilled therapists counsel in non-critical and accepting ways so that clients will reveal what it is in their spatial world. Clients are given the opportunity to explore every facet of their lives, including what they want from their family, friends, and work. This exploration of wants, needs, and perceptions should continue throughout the counseling process as clients' pictures change. Some useful questions to help clients pinpoint what they want include: needed a drink. If you were the person that you wish you were, what kind of person would you be? What would your family be like if your wants and their wants matched? What would you be doing if you were living as you want to? Do you really want to change your life? What is it that you want that you don't seem to be getting from life? What do you think stops you from making the changes you would like? And I showed a yacht. I can't swim, so the ocean is the last place I want to be. I don't know why I put a yacht in there. I really don't want one. Why would I want a yacht if I can't swim? My luck, I'd fall overboard first thing. Marcy and Marcia. Marcy was suffering from post traumatic stress disorder from a rape that had occurred 5 years before. Marcia asked her, "If you were the person you wish you were, what person would that be?" Marcy replied, "A person who isn't afraid to go outside at night or go to sleep at night." The focus on the present in reality therapy is characterized by the question, what are you doing? Even though problems may be rooted in the past, excuse me, clients need to learn how to deal with them in the present by learning better ways of getting what they want. The therapist's challenge is to help the client make more need-satisfying choices. Early in therapy, it is essential to discuss with clients the overall direction of their lives, including where they are going and where their behavior is taking them. Reality therapy concentrates on changing current behavior, not merely attitudes and feelings. To accomplish this, reality therapists focus on questions like, what do you see for yourself now and in the future? What are you doing now? What did you actually do this week? What did you want to do differently this past week? What stopped you from doing what you say you want to do? What will you do tomorrow? Marcia asked Marcy, what would you have done differently this week if you had your choice? Marcy answered, I would have slept better and maybe I wouldn't have rejected my husband. I think I blame him for the rape, even though he was at work when it happened. You need to focus on the present, Marcy. Do you feel safe when you are with your husband? Yes. Listening to clients talk about feelings can be productive, but only if it is linked to what they are doing. When clients talk about problematic feelings rather than focusing on these feelings, counselors encourage clients to take action by changing what they are doing and thinking. Discussions centering on feelings without strongly relating them to what people are doing is counterproductive. Reality therapy focuses on gaining awareness of current total behavior. This process helps clients get what they want and helps them develop a positive self-image. Marcy, I feel scared at night, so I take a sleeping pill, and then Roger just bothers me when he wants to get frisky. I love him and all, but Marcia, so you're knocking yourself out at night instead of dealing with your fear and anxiety. Marcy, hey, I'm scared that it will happen again. Marcia, weren't you drunk and knocked out when the rape occurred? Are you just returning yourself to a similar state? Through questioning, the counselor helps clients evaluate their behavior. Asking clients to evaluate each component of their total behavior is a major task in reality therapy. Individuals will not change until they first decide that a change would be more advantageous. Without an honest self-assessment, it is unlikely that clients will change. Thus, reality therapists are relentless in their efforts to help clients conduct explicit self-evaluations of each behavioral component. When therapists ask a depressing client if their behavior is helping in the long run, they introduce the idea of choice to the client. You can be depressed if you want to. You can be sick if you want to. I was told one time, I was taking a class in behavior modification. It was really kind of fascinating. And this guy said, colds aren't colds. You know, if you have rhinitis, if you have an infection from a rhinovirus, it only lasts for a matter of minutes. Sometimes it'll last for hours, but usually it's gone in a couple of minutes. But people have colds for weeks, for at least 7 days, sometimes 10 days. Well, what's that all about? And he said the reason The reason that people get colds is because they have something they don't want to say to somebody. And ever since then, anytime I have my nose gets stopped up, I always tell myself there's somebody that I need to say something to. And once I figure that out, and once I say that to that person, my cold goes away. And I keep telling people I never get sick. I never do get sick. I never get catch the flu. I never catch a cold. And the reason is because I know what a cold is. It's you needing to say something to somebody. So there you go. You can take that to the bank, or you can just keep having colds if you like. It's part of reality therapy, actually, if you think about it. So all you need to do is get that thought out of your head. It's clogging up your nose, doggone it. It's bothering your sinuses. Of course, it's going to put a lot of doctors out of business, I guess. But it's worked for me. And when did I take that class? In the 70s. I haven't been sick since the 70s. The middle 70s, like 76, 77. Isn't that amazing? Just a thought. It works for me. Maybe it'll work for you too. Marcy, I don't get drunk anymore, but I do take the sleeping pills. Otherwise, I just toss and turn. Marcia, Roger won't protect you while you sleep. Marcy, sure, but I'm still afraid. Marcia, what more can you do to protect yourself? Marcy, stay awake. Marcia, how does the sedative make you feel? Marcy, kind of drunk. Reality therapists may be directive with certain clients at the beginning of treatment. This is done to help clients recognize that some behaviors are not effective. In working with clients in crisis, it is sometimes necessary to suggest straightforwardly what will work and what will not. Other clients, like alcoholics and children of alcoholics, tend to need direction early in treatment, for they often do not have the thinking behaviors in their control system to be able to make consistent evaluations of when their lives are seriously out of control. These clients are likely to have blurred pictures and at times be unaware of what they want or whether their wants are realistic. Much of the significant work of the counseling process involves helping clients identify specific ways to fulfill their wants and needs. Once clients determine what they want to change, they're generally ready to explore other possible behaviors and formulate an action plan. The process of creating and carrying out plans enables people to gain effective control over their lives. If the plan does not work, counselor and client work together to devise a different plan. There is no rigidity in reality therapy. Marcia, this whole episode started when you went to the doctor because of anxiety over the rape. Dr. Miller gave you a sleeping pill, which seems to make your symptoms worse. Marcy, I started working more overtime at work and getting off after dark. Marcia, could this whole relapse have been triggered because you didn't say no to your boss? The culmination of the cycle of counseling rests with a plan of action. They use the acronym SAMIICCC. That's one hell of an acronym to capture the essence of a good plan. It needs to be simple, attainable, measurable, immediate, involved, controlled by the planner, committed to, and continuously done. SAMIICCC. Sammy. Marcy, I don't like the drunk feeling you get from the sleeping pills. I don't like pushing Roger away, and I don't like working overtime and getting home late. Marcia, let's see if we can devise a plan to change all these things you don't like. Marcia, how about I tell my boss no more overtime and see if I can get Roger to take me to the hotel in Banff for a long weekend. I'll go off the pills this week and run off next weekend. The plan should be within the limits of the motivation and capacities of each client. Good plans are simple and easy to understand. They should be flexible and open to modification. The plan should involve a positive course of action. It should be stated in terms of what the client is willing to do. Counselors should encourage clients to develop plans they can carry out independently of what others do. Effective plans are repetitive and ideally are performed daily. Plans should be carried out as soon as possible. Effective planning involves process-centered activities. Plans must involve doing as well as thinking. Before clients carry out their plan, it is a good idea for them to evaluate it with their therapist and determine if it is realistic and attainable and if it relates to what they want and need. To help clients commit themselves to their plan, it is useful for them to firm it up in writing. Reality therapy is applicable to counseling, social work, education, crisis intervention, corrections and rehabilitation, institutional management, and community development. It is a popular approach in schools, correctional institutions, general hospitals, state mental hospitals, halfway houses, and substance abuse centers. Most of the military clinics that treat drug and alcohol abusers use reality therapy as their preferred therapeutic approach. Experienced reality therapists have successful counseling clients who refuse to talk or even to look at the therapist. There are two ways to reach anyone. Say something that moves the therapist and the client closer. Say something that drives the therapist and the client further apart. Stan in reality therapy. Stan will try to tell his counselor how miserable he feels. During the early phase of counseling, the therapist listens to Stan and continues to reinforce the idea that she will not criticize him. She works to establish involvement with him to provide a good foundation on which to support future therapy. He will learn that all his symptoms and avoidance keep him from getting what he needs. Although the counselor listens, she also challenges Stan, especially as he focuses on his misery and symptoms. Without being critical, she teaches Stan that his depression is the action part of his choice. Although Stan feels that he has little control over how he feels, over his bodily sensations, and over his thoughts, the therapist wants Stan to understand that he can begin to take different action, which is likely to change his depressing experience. If Stan continues to focus on himself as a victim, the therapist will ask him, "Is what you are choosing to do getting you what you want?" When he complains he isn't choosing what's happening, that it's all happening to him, he will be asked, "If this is so, why isn't it happening here?" Da 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 da. It works. And it works with alcoholics. It's that reality therapy forces them to determine what they want in life. If they want to go off alcohol, if they want to stop using, then you continually challenge them to actually do what they want to do. So there you go. I'll talk to you next week. I don't remember what's next week. Chapter 12, whatever that is. Okay.